In today's Health Watch, we are looking at whether some popular weight loss drugs could have an unexpected effect. They may help reduce the risk of dementia. CBS News medical contributor Dr. Celine Gounder joins us now. She's editor-at-large for public health at KFF Health News. It's great to have you here, Dr. Gounder. So, these studies, what do you know about them? What do they find?
So there were two studies that were just published in JAMA Neurology, one of which they looked at 26 different clinical trials of these medications. These were not clinical trials specifically to look at dementia, but based on what they saw in those trials, there was a hint that these newer medications like Ozempic, like Mounjaro, may reduce the risk of dementia in people who are on those drugs. The other study looked at health records of tens of thousands of people who are on these medications. And again, there is evidence that people who are on these newer medications may have a lower risk of dementia, but it's also important to understand that these studies that were published were not specifically designed to look at that risk.
So it also sounds encouraging that a diabetes medication could help with dementia. How encouraging? I mean, put this in context for us.
Well, I think what we're seeing is there's this underlying mechanism of damage to blood vessels, inflammation, which is what's driving many of the chronic diseases we see, whether that's heart disease, kidney disease, damage to the brain, which can lead to stroke or dementia. So it makes sense that these medications may potentially have this effect.
Cost is always part of the equation. That's just the reality of life. Insurance coverage is a question mark. There was some news last week on whether insurance companies will cover these drugs. What's the latest on that?
Yeah, so towards the end of the Biden administration, they had proposed that Medicare would start covering these medications for everyone who had obesity, not just people who had diabetes or some other medical condition. The Trump administration last week decided that they were not going to move forward with that plan. And so many people on Medicare who may have been hoping that they would finally have these drugs covered will probably be disappointed now. They are very expensive. You're talking about over $1,000 a month if you're paying out of pocket. But at the same time, this was looked at how much would it cost the U.S. taxpayer to extend this coverage to everybody on Medicare, and you were looking at $35 billion over a decade. So there is a trade-off here.
Wow. Yeah, so the big equation will say one thing, the small equation maybe a whole other one, so you got to look at the big picture. Dr. Gounder, thank you very much. Really appreciate it. Great information.